First of all, let's get right down to it. I mean, these are very scary times that we're living in during this pandemic. I have a couple of questions for you, and if we can get right to it, I'd like to start right away. Who's winning the race right now against getting people vaccinated over the spread of COVID-19 and the variants?
You know what? That's a really good question. And some days it feels like we're getting farther behind, but then other days, we really are starting to get there. And I look around the province and I look at the people who have been protected with immunization. And one of the things that we're very proud of is that all First Nation communities have been immunized. All Indigenous peoples are eligible for vaccines. So go and get it now. It not only protects you, but it protects your family and your community. So we're starting to see the impact of that. So that's the good news. The bad news is we started to see a dramatic increase a few weeks ago in transmission around the province, but really, particularly in the lower mainland. So we've had to put in some additional measures. We are seeing things slow down a little bit, but not fast as I'd like. And the big worry I have right now is that we're seeing more and more people who are ending up in hospital and needing ICU care. And that's a big, big worry because healthcare workers are tired. We've been doing this for a long time, and it's really hard to see now younger people coming into hospital. So we all need to buckle down because it is going to be in this next few weeks that we're going to get more and more vaccine to people, and we can get through this next really, really hard part.
Absolutely. And speaking of younger, I was quite astonished to hear about the toddler that we lost to COVID-19 earlier this week. And certainly, my condolences to the family and to the community in a whole to understand that this is something that is affecting all of us of all ages now. I've got another question for you. When will we get data about how the current vaccines are protecting us against the variants?
Yeah, so that is something that we're watching very carefully. We have not had a lot of people who's been immunized who've now had breakthrough. We have some people, and we will be presenting that data on a weekly basis as we monitor it. So it really has come to that point where we started to see this, and we've been looking in a variety of different ways. So right now, it looks like about 0.04 to 0.07% of people who've been immunized go on to get COVID if you wait a long enough period of time. So in the first 2 to 3 weeks, your body's immune system is still building up. And we do see people who have been exposed and who get sick in that period of time. So, but after that period of time, it goes down quite dramatically. And we are continuing to watch. Anytime we see breakthrough, we do whole genome sequencing of the virus. And so far, we've not seen any variant that has been the cause of breakthrough. It's been a whole variety of the viruses that are circulating. But that is one of the things that we're watching really carefully and why we're changing how we do our testing for variants of concern so that we can focus and make sure we have the whole genome sequencing to do all of the viruses for anybody that's already been immunized and make sure we can detect if there's an issue.
Okay, thank you very much. Are there plans to create a specific vaccine for the variants themselves?
Yeah, so that is one of the neat things about the new vaccines that we have, particularly the messenger RNA vaccine, so the Pfizer and Moderna, but also the Astrazeneca and Johnson & Johnson, they're called viral vector vaccine, is that this is really cool new technology that can be changed very rapidly. So yes, the companies Pfizer and Moderna and AstraZeneca, they're all looking at whether they can tweak the RNA that's in the vaccine to be more to address the mutations that we're worried about. So, but all of these vaccines work against they stimulate your body to develop antibodies to the spike protein. And so the variants of concern means that there's a mutation that changes that spike protein a little bit. And the worry is that if it changes too much, the vaccines won't stimulate the right antibodies anymore. So yes, they are looking at that. And it is possible that we might need to have a booster with a slightly different booster dose, a different vaccine maybe in 6 months or a year or 2 years, depending on what happens when the virus changes. But really, we're learning as we go with this. Right now, the vaccines that we have, and we look at the UK, where the 117 variant has been circulating there, and the vaccine's working really well. So that's reassuring. That's a lot of what we're seeing here. We haven't seen any issues yet with the P1, which is another variant that we're seeing here. But companies are looking at that for sure.
Okay, well, that's exciting news, and I'm glad
Yeah.
that that's all happening. Of course, everything's moving so quickly, so I'm happy to hear that the companies are also moving as fast as things are happening. Um, is there any specific data on how Indigenous people are faring so far in this third wave?
Yeah, one of the things that I did very early on when we declared a public health emergency was enable us to link data. And so we don't have the perfect picture, but we can link case data and now vaccination data with the First Nations client file that helps us understand transmission in First Nations peoples. And that includes people who live in community and people who are living away from home. But we've also had a partnership with Métis Nation BC to be able to link data with the Métis Nation cohort to help us understand what's happening with this pandemic and Métis people in BC. So it's not perfect, but it does help us understand that. And the First Nations Health Authority has been our partner in that, particularly around the First Nations data. And they have had we've been monitoring cases and case rates in First Nations communities, and we were hit hard earlier this year, particularly in the second wave and the start of this wave. We've also been able to look at the positive impact that immunization has had in communities. So those are data that we're looking at, and the First Nations Health Authority is putting some of that out around cases on a regular basis, and we share it with communities as well. But we will be putting it out more publicly as well for everybody.
Okay, fantastic. Thank you. Of course, everybody's talking about the travel restrictions that are supposed to be implemented this Friday. How will that work? And how can you clarify for me what essential travel means and who is exempt from this new public health order?
So I will say this is still being worked out. It's not a public health order. It's going to be under the Emergency Programs Act. And so Emergency Management BC, and we're partnerships in these things. It was certainly on my advice that we needed to have some more measures in place. And really the focus is to try and reduce that travel that we were seeing, particularly during March break, where a lot of people went from the lower mainland to different places around the province. And we saw spread of disease because of that. So what we're talking about is travel for recreation or vacation. And there'll be very explicit exemptions. So work travel is not what we're talking about. We're not talking about going to, if somebody's moving from one place to another, for example, moving their household, or have to go for medical reasons like immunization. I know I've got a lot of questions about that. I'm supposed to get my vaccine in the community down the road. Absolutely, medical and vaccines, and if you need to go look after a person, if you're shared custody of children, those are not what we're talking about. But we do need people to do those safely and to make sure you're following all the safety protocols. It's for people going on vacation or for recreational reasons, and you don't need to go to Vancouver Island or Tofino right now. We're up to Whistler to have a vacation and meet up with a bunch of other people, because that was unfortunately what was happening. And that was leading to a lot more spread. So
Right.
we're trying to get people to stay local and don't travel if you don't need to.
Absolutely. Speaking of people gathering, we just had a 420 event. I think a couple hundred people gathered at Sunset Beach. We've had other people gathering at Kitsilano Beach last Friday, English Bay Beach. I mean, these people are not listening to your orders. What are your worst fears if this continues on and we have people that are just disobeying the public health orders that are in place to keep us safe?
It's very hard. And I speak I've had the privilege of going and visiting the colleagues who are working in the ICU and the emergency departments across the lower mainland here in Victoria. And they get so discouraged. Nurses who've been working in the ICU for this last year and a bit, and It's been exhausting. And we're now seeing young people. And it's not necessarily the young people that are out on the beach, enjoying themselves as we are wont to do when we're young, but it's the fact that they bring it home and it's being really transmissible right now. And we're seeing whole families be affected, but it's mom and dad or granny who are ending up in the hospital in the ICU. So we're seeing parents of young people who are in hospital right now, and people in their 40s and 50s and 60s. And that is very hard to see. So when you're out there, being outside is less risky than inside. And I encourage us all to go outside, but to keep our groups small. And if we're around people that we don't know, that we're not part of our household, then wear a mask and keep your distance, even outside, because you're going to bring it home to the people that you're closest to, your family, your community. And right now, we just all need to stop that for a short period of time until we can protect everybody.
In this fight against COVID and the variants, is it a very crucial time right now in the next couple of weeks in our fight against this virus?
It really is. And I know we're all tired. Heaven knows I am. But but right now we can see an end, and we just need to look around the world. Around the world, we've seen surges related to these viruses that are more transmissible. But we've also seen that vaccination is on our side. And I've been watching very carefully what's happening in the UK because there's a lot of similarities to certain things. And once you get to a certain level of the population protected through immunization, then we start to see transmission come down. And we will be there very soon. So there is an end now. It's not going like it's going to go on forever. It's going to not go back to before we had COVID, but it's going to be past the pandemic phase where we have most people protected. Right now, we have a strain on our hospitals and our ICUs, and we need to stem that tide into our healthcare system so that everybody can get the care that they need. And that's why it's so critical. Between now and the end of the May long weekend, we all need to just stop, because we'll be able to get immunization and protect people. About 60% of adults will have been immunized if we keep going in the rate we're going by the end of the May long weekend, which means we're at a point where most people are going to be protected. And that's important. And then it takes some time. We'll still need to wear masks and we'll still need to keep in small groups. But that means we can take that burden off the hospitals, and that we can start to think about what our summer is going to be like.
There are many people that I've spoken to that they're hesitant about getting a vaccination. They're hesitant because they compare it to getting a flu shot, and they think it's like a mini COVID virus that's getting put into them. Can you please clarify exactly the fears of people that are worried about this shot? Can you tell them exactly what the vaccine is and how it works?
Sure. So, this is one of the most exciting things that's amazing to me. Within a year of a new virus emerging and causing havoc around the world, minds have come together and they've collaborated, and scientists have shared information in a way they've never have before. So we have brand new types of vaccines. And not only are they new, so this messenger RNA, it takes a little piece of the code of the RNA of the virus that codes for that spike protein. And it wraps it in a little bit of we call it a lipid nanoparticle, but a little bit of kind of like olive oil, I guess, a little bit of a fat molecule to protect it. And then that is what gets injected into our arm, and it goes into our cells and stimulates our cells to start producing antibodies to that protein. So it's amazing. And then it goes away. So I understand there's a lot of like, oh my gosh, this is new technology. We've never used this before. It's been in development for about several decades, and they were trying to use it for cancer therapies, for specific cancer therapies, and for vaccine against rabies. One time, but this is a new technology, and not only is it new, but it works in older people, and that's kind of amazing for those of us who've been working in vaccines for a long time. So one of our challenges with influenza vaccines that we have, they're called protein subunit vaccines, is that they don't work as well in older people. But this vaccine protects older people. And we saw that in our long-term care homes. And that's, I've used the term miraculous, but I really believe that. And what we have seen now with millions of people around the world who've been immunized with all four of the vaccines that are approved for use. We only have three that we have so far in Canada. So the Pfizer vaccine, the Moderna vaccine, the Astrazeneca vaccine, is that these vaccines work, and they work in everybody, and they're safe. We did see a signal of concern and pause things with the AstraZeneca vaccine for a little while until we understood it. We now know that yes, it's associated with a very rare type of clots, but these are like 4 in a million. And right now in BC, our rate of people going into hospital is about 2 in 100. So a really teeny risk compared to the benefit that we get from these vaccines. So what I say to everybody is, and I know lots of people had questions early on, and that's why I got my vaccine very early to say, well, yeah, it's new, it's we have lots of questions. Is it safe? And yes, it is. All of these vaccines are safe and they work. And take the one that you are offered first, because that's how we're all going to get through this. It not only protects you, but it protects your family and your community too.
The ratio of infection, what you mentioned, is that the reason why the government has approved people as young as 40 to receive the AstraZeneca, where the age group was up to 55 and above?
Yeah, so we stopped it in because it was concerned that it was in younger people. So there's two things about this. The risk of these very rare blood clots is the same across all age groups. But why we stopped it in younger people is because the risk of COVID wasn't as great in younger people. So you have to weigh off, oh, is this, this serious side effect? And let's find out exactly how often it occurs and what's causing it. And we now know as well that there's a test for it and a treatment for it. So that's one side of it. So this, the AstraZeneca vaccine, and we have right now, the stuff that we have is from the US. It is approved for use by the regulator, Health Canada. It's safe to use in all adults over age 18. In BC, because we have a relatively limited supply, our decision has been that we're going to focus on giving it to people who are 40 and above, because those are the people who are ending up in hospital right now. And our focus right now is to try and prevent people from ending up in hospital. But I expect that we'll be able to lower that age group, and most of the places around the world are using it in younger people as well. In the UK, down to age 30. I think we'll eventually. It depends on the risk in our community, but definitely right now we're focusing on trying to protect people from hospitalization.
Speaking of the younger groups, when can we see the vaccine be applicable to people that are children or teenagers?
Yeah, so the Pfizer vaccine is approved for use down to age 16, but we've been focusing mostly on 18 and above, because you're never sure if it's going to be Pfizer or Moderna, given the way our vaccine has been arriving, and AstraZeneca is 18 above as well. But once we get through that age group, we'll be moving down. But they're also doing studies. So there's two that should be coming online very soon. Pfizer has done a study in young people aged 12 to 16, and the Moderna has a study that just started down to age 6 months. So we are likely to have vaccines that work well in children, probably in the summer and before next school year.
That's fantastic. I'm sure that's a
Yeah.
huge relief to many of the parents that are watching this today. Can we talk just quickly about the variants, and what are your concerns about how quickly it's spreading in our younger population, especially?
Yeah, one of the things that we know about viruses is that they every time they replicate, they can change, and that's when mutations can happen. And this is an RNA virus, so it only has a single strand. It has no spell checker for when it replicates. So the more people that are infected, the more different types of viruses you're going to have, and they'll all be slightly different. Why we call them variants of concern is because there's a number of them where these mutations have led to the virus being more transmissible or causing more severe illness. And so far, there's the fact that they've come to Canada before we even knew that they existed is part of our issue, but they have a survival advantage over other viruses. So once the B117 is in a community, it's the one that's going to spread the most. So we're going to see more cases from it, and they're going to be more transmitted to others. So that's what we've seen happen around the world. We're seeing it happen here. For us here in BC, it's about 60% now of the new cases are either B117, mostly in the Fraser Valley or the Fraser Health region. In Vancouver Coastal, we've seen quite a lot of transmission of the P1, which is also more transmissible. So that's the pattern that we've seen around the world. So the things that we need to do to stop these variants are the same things for every other part of the wild type virus that we've seen, which is keeping our groups small, wearing a mask when we're out in public places, particularly indoors, not having people over for social connections and social gatherings, particularly indoors. All of those things that we know how to stop this virus, they're the same for these variants too.
With cases averaging almost 1,000 a day here just in BC, are you prepared to look at full lockdowns like Ontario is going through right now if the situation continues to get worse?
Yeah, I think it's a bit of a misnomer, this whole concept of lockdowns. And if you look at the measures that we have in place, they are the things that we know work. And we are focusing on specific workplaces because we know that's an area where there's a lot of transmission. And the program that we have is instead of closing everything down, what we learned in March of last year, and what we've learned from the survey that people have taken, and from a whole lot of other things, is that when you have this sort of lockdown concept, it really affects people's emotional and physical health. It affects our we talk about the economy, but it's more about people's ability to care for their families and support their families, and work is a really important part of that. But we need to do it safely with COVID safety plans. So our intent is not, obviously, we're trying right now to protect our hospital system, and that means we'll take some more measures in hospitals. We're trying to put in additional measures around preventing travel, and we want people to take seriously the social connections, because it is there where we are passing this virus on to each other. So this is what we need to do. We've started to see a leveling off of our cases in BC. We need people to stay the course. Stay the course right now. Get vaccinated.
On a personal note, Dr. Henry, you have been there front and center every single day giving us updates, and we do honestly very much appreciate that. How big of a toll has this taken on you personally to be up there every day giving these updates to everyone?
Oh, well, thank you. It is part of my role, I guess. And I realize and I take to heart that I'm speaking for a very strong team of public health and our healthcare system, and people who are working very hard on this every day. And that is what keeps me going. And what I think it was Maya Angelou who said, I do what I do because I'm depending on you, depending on me. And that is an important part of how I approach this every day. But I also, I personally do feel all of the trauma, the sacrifices that all of us have made, and everybody has made little and big sacrifices, and it's been hard and it's been tiring, and we're all exhausted, and I feel that too. And right now, I just really feel like it's my job to let people know there's an end to this. And I said this last year, but it is true. It is not forever. It's been a very hard year, but we know what we need to do. And we can't rail against the things that are happening and wish them away. We have to deal with what we're dealing with now, and be patient with each other, and continue to do that from a place of kindness, because kindness is what is going to get us through this.
Fantastic. Thank you very much for your time today. We really appreciate that. And we look forward to another day when we can, gather with our friends once again and do it a
I look forward to hugs.
Yes, indeed. Absolutely. Thank you, Dr. Henry, for joining us today. We really appreciate all the work that you do.
Thank you.